Hi, class, Dr. Lindner. Now, in terms of regeneration and repair, there's something called neuroplasticity. Neuroplasticity is maintained throughout life. It's the ability of sprouting new dendrites. Whenever you're taking on a new activity or learning something, you may not be that coordinated. You may be a little klutzy the first time you throw a baseball or shoot a basketball, but when you do it with practice over and over and over again, you could sprout new dendrites. Your body synthesizes new proteins. There's changes that occur in synaptic contacts with other neurons. And this happens throughout life. The brain always wants to grow and learn. A stimulated brain is essential for life. We often hear when people retire and they don't do much and they're sitting around all day, they typically degenerate and die not too long after retirement. But as long as they're physically active, they're moving their body, their brain is stimulated, they're much healthier. There are many drugs and medications, especially a lot of the anti-psychotropic medications that actually block your ability. It like numbs the individual so much that they don't even feel like themselves anymore. They can't learn anything new. It slows down the synapses, the neurons. They just can't process life as well as a person that's not on these medications. It becomes very dangerous. There is limited ability for the neural system to repair. If there's damage in the peripheral neural system, then you could regenerate and repair. But if there's damage in the central neural system within the brain and the spinal cord, there's typically no repair that is taking place. Now, in terms of neurogenesis, the formation of new neurons from stem cells was not thought to occur in humans. But in 1992, a growth factor was found that stimulates adult mice brains to multiply. In 1998, new neurons were found to form within the adult human hippocampus. So this is important for areas of learning. So this is amazing. I mean, when neurons die in the brain, those cannot regenerate. But through movement and forcing your body to move and learn, the body can generate some new ones, which is pretty fascinating. It just takes a long time for it to occur. Factors that prevent neurogenesis in the central neural system: it's inhibited by neuroglial cells, the absence of growth stimulating factors, and the lack of neurolemmas and very fast, rapid form of scar tissue that can prevent neurogenesis. In terms of some neurological issues, a biggie is MS, multiple sclerosis. It's an autoimmune disorder that causes destruction of the myelin sheath. It can impact about 500,000 people in the US. It can appear between the ages of 20 and 40, females twice as often as males, and it can often mimic a B12 deficiency because we need B12 in order to form myelin, and not just B12, but we need B6. We need something called methylation, which is dependent on B6, B9, and B12. B12 is the biggie, but B6, B9, and B12 all work together for what's called methylation. And methylation helps produce myelin. Okay, this is where you may have heard of people that have MTHFR, methylene tetrahydrofolate reductase. Some people are born with lack of that enzyme, MTHFR. So you would get tested for the C6, let me see if it's the C677T and the A1298C. Those are the two that would be checked for MTHFR for either heterozygous or homozygous. These are people that also, when they have these variants, they have migraine headaches, difficulty in losing weight, depression, ADD, autism, a lot of these type of issues tend to be positive in MTHFR. Symptoms of MS include muscular weakness, abnormal sensation, usually shows up in the eyes first with double vision, visual defects because the eyes have pretty small nerves. So eyes show up first, then typically clumsiness in the hands and dropping things, or feeling of heaviness in the legs. These are signs of MS. And again, you're breaking down, it's an autoimmune breakdown of the myelin. So this can affect the oligodendrocytes or the Schwann cells. And these things can go into remission and they can relapse. They can be asymptomatic for almost a decade at a time. And then under times of stress, it just downward spirals. Most people use immunosuppressants for this to try and suppress the immune response from attacking. But it's a neurological, progressive, degenerative disease. In terms of epilepsy, this affects about 1% of the population, and it's characterized by short, reoccurrent attacks initiated by these abnormal electrical discharges in the brain. And things can trigger it and set it off, like lights and flashing lights, certain noises, even smells. It'll affect the skeletal muscle contraction. It'll be involuntary muscle contraction, even loss of consciousness. And epilepsy has a variety of causes. It could be some sort of brain damage at birth. There could be metabolic disturbances, infections, toxins, vascular disturbances and imbalances to blood supply. Obviously, TBIs, traumatic brain injuries, and even tumors.